Okay, let's just dive right in because honestly, this is infuriating. We're talking about what looks like a five-alarm fire for public health and, frankly, basic governmental function.
It really does feel that serious. The scale of what's being alleged is pretty staggering.
It is. Welcome, everyone, to the Deep Dive Report Show with Mike and Sam. Today, we're digging into what many are calling a coordinated malicious attack on our health agencies.
And the focus seems to be squarely on actions taken during the Trump administration, with Robert F. Kennedy Jr. specifically mentioned regarding his role at HHS.
Exactly. And look, let's call it what the people bringing the lawsuit are calling it. Deliberate fucking sabotage. That's the accusation, not just, bad management or bureaucratic fumbling.
It's a very strong claim, suggesting intent to actually harm the agency's ability to function, not just streamline it, as was the official line sometimes.
Which brings us to the lawsuit. Finally, some goddamn spine from 20 state attorneys general, all Democrats, by the way.
Yeah.
They filed suit against HHS, Kennedy Jr., and the Trump administration itself.
That's a significant move. 20 states unified like that. It signals they believe there's a very serious legal and constitutional issue at play here.
You bet. And the core reason. They allege the administration has been systematically dismantling HHS, firing key people, restructuring divisions, all under the guise of streamlining.
That word streamlining, it sounds positive, efficient, but the AGs are clearly challenging that narrative head on.
They really are. New York Attorney General Letitia James put it bluntly. She said, "This administration is not streamlining the federal government. They are sabotaging it and all of us." I mean, wow.
That quote really captures the essence of their argument. It reframes the entire situation from efficiency to, well, destruction.
And it's not abstract. Think about who gets hurt here. The lawsuit points to scientists researching infectious diseases, doctors helping pregnant patients, programs for sick minors, for vulnerable kids.
These aren't just line items on a budget sheet. These are critical functions, lifelines for many people. Undermining them has very real human consequences.
Absolutely. Now, the AGs point to what they see as a smoking gun.
Yeah.
A directive from March 27th. This thing apparently laid out massive cuts and reorganizations.
The March 27th directive.
Right.
That's likely the central piece of evidence they're building their case around.
It seems so. They're asking the court to declare it unlawful and unconstitutional. Their argument is basically this. It's an illegal power grab designed specifically to cripple essential government functions.
So not just a bad policy decision in their view, but actually exceeding executive authority.
Exactly. Because, they argue, the administration fundamentally doesn't believe government should be doing these things, serving the people in this way.
Which makes it less about efficiency and more about ideology and potentially overriding legal mandates given to the agency by Congress.
And they're saying this March 27th directive wasn't just some random Tuesday decision. They frame it as the culmination, maybe an escalation, of a years-long campaign by the administration.
A campaign to do what exactly?
To starve HHS, to bleed it dry of resources, of personnel, of its ability to actually function effectively.
So a pattern of actions over time leading up to this directive, which perhaps formalized the damage.
That seems to be the argument. We're talking about, reportedly, plans to potentially fire thousands of public servants.
Thousands? That's a huge number for any agency.
Huge. The plan was supposedly to collapse 28 different divisions down to just 15. Think about the loss of expertise, the institutional knowledge just gone.
That kind of restructuring, even if done carefully, is massively disruptive. Done allegedly carelessly, as the lawsuit suggests. Well, the potential for damage is immense. You lose that deep specialization.
And it hits locally, too. The plan apparently included slashing the regional HHS offices from 10 down to just 5.
Half the regional offices. That immediately brings up concerns about access, especially for people not in major urban centers. How do they get services? How does HHS stay connected?
Right. It makes government less responsive, less accessible, just pulling back when people arguably need these services more than ever.
And how did Secretary Kennedy allegedly handle this? The lawsuit claims he refused to undertake this restructuring legally or carefully.
That's the allegation. Speed over due process, results, or perhaps dismantling over a careful consideration of the impact or, the legality.
Which suggests a potential disregard for administrative procedure law, something these AGs would definitely focus on. Agencies can't just restructure on a whim. There are rules.
And get this, the justification, cost savings. They were talking about potentially cutting nearly a quarter of the HHS workforce, maybe 20,000 people.
20,000 jobs for cost savings. Okay, how much savings are we talking about?
This is the kicker. The claim is these massive cuts would save less than 1% of HHS expenditures. Less than 1%.
Wait, seriously, less than 1% for potentially 20,000 jobs and gutting entire divisions.
Seriously, that's what's reported. So the AGs are basically saying, come on, this isn't about money.
That figure makes the cost savings argument sound incredibly thin, almost pretextual.
It's exactly. Especially since Congress hadn't apparently slashed their funding. Appropriations were reportedly stable, even up in some areas. This feels ideological. It feels like dismantling for dismantling's sake.
If the financial justification doesn't hold water, it forces you to ask what the real motivation was. And the AGs seem to be supplying an answer, an agenda against these specific government functions.
And the lawsuit hammers home the real-world impact. It's not just numbers. It's about whether these agencies can actually do their jobs, the jobs Congress told them to do.
Right. Can they fulfill their statutory mandates? That's a core legal question. If these cuts prevent that, the executive action could be seen as undermining the legislative branch's intent.
Think about the CDC. Crucial, right? National security, global health. The complaint reportedly says about 2,400 CDC employees were terminated on April 1st.
April 1st. That timing alone is notable. And losing that many people from the CDC, especially given, well, everything we know about public health threats, it's deeply concerning.
It's staggering. And look at some other specific targets reported in the complaint. All the people handling Freedom of Information Act requests. Gone, allegedly.
Wow. That directly impacts transparency, doesn't it? Makes it harder for the public, for journalists to know what's going on.
You bet. Key communications staff, too, reportedly let go, limiting the flow of public health information. Doesn't sound good.
No, that sounds like trying to control the narrative, or worse, just creating an information vacuum.
But maybe the most chilling detail, the alleged impact on the CDC's infectious disease labs. These are the places that detect, identify, study dangerous pathogens.
The front lines of pandemic prevention and response. What happened there?
The lawsuit reportedly claims these labs were either shut down entirely or had their capacity severely reduced. I mean, weakening our ability to spot the next pandemic. That's
incredibly dangerous. In today's world, that capacity isn't optional. It's fundamental to safety. Reducing it seems reckless, frankly.
One of the AGs leading this, Peter Narana from Rhode Island, he put it starkly. He reportedly said, since day one, this president and his administration have attempted to illegally decimate agencies across the federal government.
So he's framing it as a much broader pattern, not just HHS in isolation.
Yes. And he pointed to the context, measles rising, the constant threat of new pandemics. He asked essentially, why now would you take an axe to the agency responsible for the health and safety of Americans?
It's a powerful question. It highlights the apparent disconnect between the alleged actions and the obvious public health needs of the country.
It really does. And, you know, the appointment of Robert F. Kennedy Jr. to a key HHS role during all this, that's drawn a lot of fire, too.
Yeah.
Critics suggest it fits this pattern of undermining the agency from within.
Having leadership whose views might be seen as outside the mainstream scientific consensus on public health issues, well, it naturally raises concerns about the agency's direction and effectiveness.
And the fact that it took 20 AGs, representing millions and millions of Americans, to file this lawsuit, it just shows how serious this is perceived to be. This isn't just politics as usual.
No, it suggests a fundamental disagreement about the role of government and a belief that core functions were being illegally undermined, impacting people across many states.
The narrative here, from the perspective of the lawsuit, is a government actively working to dismantle itself, prioritizing that over actually governing effectively.
It points to a potential philosophical clash. Should government provide these safety nets and research functions, or should it be drastically smaller, regardless of the potential consequences?
And that claim about saving less than 1%, it just hangs there, making the stated reasons look, well, suspect.
When the justification seems wildly disproportionate to the action, you absolutely have to question it. It's just the real reasons might lie elsewhere.
So the legal fight is on. The argument isn't just this is bad policy, it's this is illegal, violating administrative law, violating the Constitution, bypassing Congress.
Essentially an accusation of executive overreach on a grand scale, attempting to reshape a major part of the government without the proper legal authority.
And the potential long-term damage. Losing all that expertise, disrupting research, eroding trust. How do you rebuild that? How do you convince dedicated scientists and doctors to work there again?
That's a critical point. Public service relies on attracting talented people who believe in the mission. Actions perceived as destructive can have a chilling effect for years to come.
So wrapping up this deep dive, the picture painted by this lawsuit is, frankly, alarming. A potential gutting of HHS, key personnel dismissed, critical functions weakened.
It definitely underscores how important oversight is and how legal challenges like this one play a role in holding government accountable, especially when public health is on the line.
Absolutely. This lawsuit is a major pushback, defending the idea that government needs to follow the law, use evidence, and serve the public interest. It's a critical story to follow because the implications could easily stretch beyond HHS. That tiny savings number for such huge cuts. It just sticks with you, doesn't it? Makes you wonder what was really going on.
It forces a reflection on what we expect from government, the value we place on expertise, and how vigilant we need to be about protecting the institutions designed ultimately to protect us.
You've been listening to the Deep Dive Report Show. Please like this deep dive, share it far and wide. People need to know this stuff. Definitely subscribe so you don't miss our next report, and click that notification icon too. Stay right up to date.
We'll keep tracking developments.
You'll catch us in the next breaking news.